Dr. Michael Ryan with Missouri Vein Care, answering the question, what effect does hormone replacement therapy and progesterone have on vein health and vein symptoms? Well, it's a fairly well understood correlation between certain hormone levels and vein symptoms in women. Obviously, if you don't have a vein condition, the hormone levels in your body are not going to create a vein problem. But if you have a vein condition, the hormone levels associated with your condition will be worsened, will worsen the symptom. The one that appears to be most responsible for discomfort is progesterone. Progesterone and estrogen are two hormones that cycle, and they have a pattern that's very intertwined with each other. And progesterone peaks about 2 weeks before the menstruation begins. That appears to be the time when the veins are most painful and uncomfortable. Progesterone seems to make the veins dilate or get bigger. As the veins get bigger, the little valves inside get pulled apart, and the blood is no longer able to stay in the section of the vein it was meant to stay in, and it rushes down towards the leg, causing pressure to build up. And for women that do have a vein condition, it's quite predictable during their menstrual cycle when they're going to start having more leg symptoms, and that's from month to month. It's always going to be usually about 2 weeks before their menstruation. Similarly, hormone replacement therapy has a formula that has a altering level of progesterone and estrogen, so there will be a similar pattern. It may not be exactly 2 weeks, but it's going to be similar to the natural cycle where the progesterone will be the main trigger for the worsening of the leg symptoms. So, Dr. Mike Ryan, answering the question, does hormone replacement therapy and progesterone affect vein symptoms?